Well, good morning, everyone. Welcome to our program this morning, MSP Wellness, Workplace Health Equity and Employee Wellbeing. You should be able to see the slide to start off with, just on some helpful points for running the program in terms of being on mute while the program is going on. There will be an opportunity for you to engage throughout the program. I'd encourage you to use the chat feature at the bottom of your screen to ask questions as we're going along, and there will be some time to do that toward the end. So this is really an exciting and important topic. I know it came up there a little bit in the chat. I'm Brent Pavia, president of the Bloomington Chamber, vice president for the Minneapolis Regional Chamber, and we have, in partnership with the Minneapolis Health Department, a program called MSP Wellness, and we'll follow up at the end, and a follow-up email a little bit more about that. It started about 3 years ago in terms of engaging mostly small to medium-sized businesses to start or enhance a workplace wellness program, and there's a website that we've created devoted to all sorts of health and wellness topics, in addition to the cohort and the programming associated with that, which this is a part of, is something that we've expanded as well. It's space that we should have been in a long time ago, and as we grow it out, we realize that there's so much to it. This topic, unfortunately, it's not new. In fact, it's not even new to the chamber. I think it's about 5 or so years ago, we did a program where we brought in Dr. Anthony Eiton from the California Endowment to the Twin Cities, and I think the title of his talk was, "Does your zip code matter more than your genetic code?" And really made a compelling case about how so many other factors influence health outcomes. And you may have heard about the city of Minneapolis declaring racism a public health emergency, and other communities that are doing the same or considering the same. And so we brought together some folks to talk about that in terms of what does that mean? How does it affect the business community? How we can all engage in that. Really fortunate to have some incredible experts on the panel and moderating. And as opposed to me doing introductions, I want to get right to that. Like I said, there will be an opportunity for some follow-up and some resources at the end of the program, but also afterwards in a follow-up email. And this session will be recorded as well. But let's get right to it. To introduce the topic and to tell everyone to frame it, I'm going to send this over to Christine Smith. Christine, take it away.
Good morning. Can you hear me? Thumbs up if you can hear me. Yay, awesome. Technology, our new world. Hello, everybody. Welcome. Thank you so much for being here today. My name is Christine Smith. I am a descendant of Red Lake and White Earth Nation. I'm also a descendant of George Bunga, who was one of the first African-American people here in Minnesota. He was a fur trader up in Duluth. I currently work at the Minnesota Department of Health in the role of Health Equity and Tribal Grant Supervisor. I've had the privilege of working for the state of Minnesota for 8 years. Absolutely love my work. It's been a lot of interesting learnings and just meeting a lot of really good people. I love meeting people across the state. However, I started my work of the world of equity in Minneapolis. Actually, I was working at the American Indian OIC and was working for a program called the Minnesota Family Investment Program, so an employment services program for low-income parents. And we had learned about some data that the Minnesota Department of Human Services had published called a disparities report. And that was the first time I had ever heard that that data or that language. But I thought, wow, this is really interesting. So they shared with us this report, and it showed that Black and African American and American Indian participants on the Minnesota Family Investment Program were less likely to be successful than all other racial and ethnic groups. Parallel to that, there was also a report done by Algernon Austin that talked about the employment disparities for African American folks in the city of Minneapolis. And so a council member pulled a group together called an Equity and Employment Task Force. And I was a member on that task force for about 4 years. So got to know some of the folks in the city of Minneapolis. I ended up kind of veering out on my own and having some conversations with different folks that I knew in the community, different professionals and friends of mine, and talking to them about this employment disparities, because I just kind of noticed it was the group kind of kept spinning its wheels for about 4 years. And so I started my own group called the Metro Talking Circle, and we came together and proposed to this task force that we would help them identify a strategic plan. And we partnered with Councilmember Gordon, and later that plan turned into a resolution that was done in 2012 about equity and employment. So it's really cool to kind of come full circle here and back into the city of Minneapolis. And I just think it's important to note that, because it just shows how things do just really come full circle like that. I mean, I wouldn't be here today talking with you had I not been where I was working with folks on the ground. That was a very real seeing families kind of going through the struggles that they were going through, and then dealing with the system barriers. And then now I'm on the side of working with systems. And so I've had a lot of opportunity to see all the different levels of barriers. So this concept, when we talk about equity, is very complex, and everybody's talking about it right now. We hear it all over the place. Equity, racial equity, this, we have an equity plan. I've got to the point now where I'm like, let's try to just not talk about equity. Let's talk about equity without using that word for a week, right? What are we actually talking about? And so when I think about that, and when I talk to folks about that I work with, I like to think about why we're talking about equity, right? And the reason why we're talking about equity is because of disparities. That's the reason why we're even talking about equity. And what are disparities? Where did disparities come from? Well, disparities, when we're looking at different things, come from structural racism. And in order for us to be talking about equity, we can't talk about equity without talking about structural racism. A piece that I've found in my conversations over the years, so I am a multiracial person, and so having these conversations tends to be a little bit easier for me because I have them at home. And so then when I come into workplaces and have these conversations, then folks might not have had those conversations with other people from different backgrounds before, and it causes some discomfort. And so one of the things I've noticed in the years that I've had these conversations is the level of discomfort that both white and Black and other populations have when we come into these public spaces and start talking about things like structural racism. And it's a discomfort for different reasons. So I like to differentiate this concept of discomfort from safety, because those are two different things. Sometimes people think when they feel a sense of discomfort that they're not safe, and that's not always true. However, sometimes people can be unsafe and feel a level of discomfort. And so it's really important to know, like, are you in this space having this conversation? Are you unsafe? And it's important to know that. Am I professionally unsafe? Am I going to be retaliated against based on what I'm saying? Am I going to not be invited to key meetings anymore because of what I'm talking about? Am I not going to be up for this promotion because of what I'm talking about? So it's important to know the difference between lack of safety and discomfort. There's a term that I'm sure many folks have heard. A woman named Robin DiAngelo wrote a book called White Fragility. And so that's something that I've seen over the years when I would have these conversations with folks in institutions and in structures. I would see white people oftentimes would cry or would get really upset when we would start going really deep into these conversations. And I didn't understand why for years. But then as I took a step back and started reflecting on other training that I've had, understanding trauma, many of you have probably heard of or not, the Adverse Childhood Experiences Study, which was published in 1997, I started doing some work understanding childhood trauma and the impacts of childhood trauma as well as historical trauma. And I started seeing some of the reactions from different folks in these conversations as being trauma responses, very similar to trauma responses. And so I said, you know what, we have to slow down a little bit. And instead of going full steam ahead, which is what I often do in these equity conversations, and really ground folks in trauma-informed principles and really creating a safe space so that people can have a healthy level of discomfort when having these very, very important conversations to move us all forward in a good way. But that's where people have to really understand and make that investment into understanding trauma-informed principles. And so for the past 3 years, I have been doing work both inside and outside of the department in my conversations around equity and structural racism, et cetera, by using trauma-informed principles, and just really making sure that we don't know where people have been, where they've come from, whether they're white or Black or whatever their family heritage is. And right now in our country, we're at a very heightened state of emotions, of a lot of polarization, especially right now when we're getting ready to enter into this presidential election and things like that. And it's bringing up all different kinds of emotions for folks. And so just taking what we do know that a large part of our population does have adverse childhood experiences, does have trauma. We know a large part of our population, folks that have their ancestors or relatives have been in collective trauma, have historical trauma. And so how can we take a more trauma-informed approach when we're entering into these very highly sensitive conversations? And that's something that I'm happy to be able to be at this conversation to talk about and be on a panel with other wonderful folks to just share. That's just one piece that I add to this conversation. So with that, I will pass it on, but I just wanted to say thank you again to folks for having me and for participating in this very important conversation. Look forward to the continued conversation.
Hi, everyone. Can you hear me? I'll ask for the thumbs up too. Can everybody hear me? Okay, awesome. Great. So thank you so much, Christine, for that opening. My name is Jenna Carter, and I am the Public Affairs and Government Relations Manager at Blue Cross and Blue Shield of Minnesota. And I am also an at-large council member for the city of Bloomington. And I guess I'll just say a couple of things about the two hats that I wear. So at Blue Cross, I've been there for several years. I'm working with my colleague vaishan on issues related to health and racial equity. And it's really what has fueled a lot of my own passion and the work that I've done in this space. And it's a big reason, my work at Blue Cross is a big reason why I decided to run for Bloomington City Council last year. And a lot of what I learned about the racial inequities that Christine was talking about, how zip code can be a big determinant of your health, really has informed the way that I approach everything in life now. And so I'm in my first term on council, and never could I have imagined that this is what the first 9 months was going to be like. But I am still incredibly grateful to have had the opportunity and to have done it and to be in the position that I'm in, because now, as Christine mentioned, I mean, this conversation has elevated to a whole new level, and the work that we have to do as a community, as business leaders, is significant. And we have a really a huge role to play in really making sure that we are addressing the racial inequities that we see in Minnesota across issues, whether those are health inequities, educational inequities, economic inequities. And so I am just incredibly grateful to be here today. I'm honored to be on moderating a panel with such incredible leaders, health and racial equity leaders, and then also really grateful to be able to have this conversation with all of you who are business leaders in our community. So I will ask now for Vaishan to introduce himself. And I also just wanted to let everybody know that Brandon Jones is another one of our panelists, and he is going to be joining us probably about halfway through. He had something, sorry, I have to turn the sound off my computer. He had something come up at his work. And so Anna, when he gets here, I will just ask that you let me know. And so I can make sure he can introduce himself. So Vaishan, do you want to introduce yourself now?
Sure. Thank you. I'm Vaishan Moore with Blue Cross Blue Shield of Minnesota, and I'm the Racial and Health Equity Advocacy Director. Jenna, I'm going to call upon you to help moderate me and in all forms of that word, right? So please, I come from a oral and storytelling tradition, and so please help me manage my energy there. I've been with Blue Cross for 15 years now, this last September. And it's this conversation is actually a kind of loop back for me. My first couple of weeks at Blue Cross, I remember getting thrown right into the Hennepin County's smoke-free ordinance fight. And I remember coming into the boardroom and there were tobacco lobbyists there. They just stand out with their suits and their swagger, misplaced swagger, I should say. And I just was thrown headfirst into, excuse me, the tobacco battles, if you will. I just want to share that my work and my role has evolved quite a bit from then. And I think it's relevant to today's conversation. Moving from commercial tobacco control, like smoke-free ordinances, pushing for increased taxes on cigarettes, and obviously now dealing with e-cigarettes and vaping. We've taken on food systems, trying to build and design active communities and support active transportation. And perhaps most relevant for today, I think the evolution of public health is to not abandon various issues or topics like chronic disease, tobacco, food, or physical activity, but to go upstream, to really examine root causes of health and racial inequities, and to begin designing and advocating for long-term solutions. And a lot of that points towards health and racial equity integration into governance, right? And governance across sectors, whether it's policymaking or at a board level or at a nonprofit level. But it's really about how priorities become priorities and how decisions are made. And less about like just one certain subject, because we know that the inequities we see in food security or employment or housing or graduation rates or insurance coverage, Minnesota, we unfortunately have some of the worst in the country. And I'm happy to send you a link and data that shows kind of, unfortunately, supports and validates that. We are a state of high peaks and low valleys, right? And I think we need to begin to interrogate, why is that the case? Why does Minnesota have this funky, disturbing phenomena? And so I just want to, in my introduction, lay the groundwork that my personal work and our work in health and racial equity includes issue advocacy and focusing on specific topics, but it's really more about addressing the inequities in leadership, in decision-making, in power. And I know I'm running off kind of far, Jenna, but I also want to thank the Chamber and the City Public Health Department, because this partnership is, and I said this to Brent and the team earlier, is very unique and necessary, because it represents what we call the social determinants of health. And if we don't, I don't have this nifty infographic for you all to look at, but if you were to see all the various determinants of health, what creates health or what creates the absence of health, 90% of what creates health is actually outside of healthcare. It's in employment. It's in housing. It's where you live. It's also based on race, ethnicity, gender, right? And the physical environment. And so your partnership actually represents a great need for the future of public health. So I'll leave my introduction at that, Jenna, and I probably spilled into some of the future questions too, but thank you.
Oh, that's perfect. Thank you, Vaishan. So I did get a note that Brandon Jones has joined us. And so Brandon, if you are ready, Christine and Vaishan have introduced themselves, and I would love for you to have the opportunity now to do so too.
Absolutely. Good morning or afternoon to folks. Sorry for my tardiness. I'm Brandon Jones. I'm a psychotherapist, professor, and a consultant. My consultant agency is called Jegna Institute. And really what we focus on is making sure that people are focusing on healing. And healing does include equity, diversity, and inclusion. And one of the things I think that we've been kind of forced into and pushed into to focus on more during this time in the aftermath after George Floyd is really looking at how do we maintain wellness in a space where we have uncomfortable conversations and we need to support one another all the time. And I think in the business world, a lot of times we think of health, we think of healthcare, but we don't always think of wellness. And as what was previously stated, a lot of the things that indicate wellness are these social determinants of health things that are outside of the actual medical and healthcare system. So I think we're in a space where we have to be creative to rethink about how do we do equity and how do we support the differences in our employers and our services and products, because in those differences are strengths. So I look forward to today's panel and today's conversation, and thank you for allowing me to be here.
Thank you, Brandon. So I have a couple of questions prepared, but if anybody who is on the Zoom call now has questions, please put those in the chat function, and I will do my best to monitor that so I can get those questions asked and you can hear the panelists' answers. And before we do that, we do have a little poll that we are going to ask you to respond to, just to get a better sense, just for the panelists to get a better sense of where you kind of are at in your own understanding of health inequities and anti-racist practices. And so if you could just take a minute to answer that. I know for those who are joining via phone, you won't be able to participate, but for those who are actually on the Zoom call, please just take a second to answer that question. And then when we have mostly everybody responding, I'll have Anna share. I don't know, I guess that we weren't clear on this. Anna, will you be sharing that with everybody or sending that to the panelists so they have a sense?
We'll share it with everybody.
Okay, perfect. And while everybody is completing that poll here quickly, I also just want to extend my thanks to the Chamber and to the City of Minneapolis and to all of the panelists for your participation today. I know these conversations can be really, especially for, so I guess I'll back up a little bit. As somebody who is white, I cannot fully understand what it is like I'm sorry, that was pulse popped up. I don't understand what it's like to live as a Black or brown person. But I have heard repeatedly from my colleagues, from my friends who are people who are from BIPOC communities, that having these conversations can be really exhausting. And then sometimes they can be traumatic in and of themselves. And so I know that many of the leaders on this call are asked to have these conversations quite frequently. And so I want to thank you very personally and deeply for your willingness to be here today and to share so much of your wisdom and your truth and experience. And so thank you. Okay, so I think everybody saw the results. The panelists have that information. And so since this is an event on workplace wellness, my first question for each of you, can you talk about the connections that you see between diversity, equity, and inclusion, trauma-informed practices, and employee well-being? And I guess I'm looking at my screen, and so it's like I'll swipe and see which panelist I see first, and I'll call on you. So Vaishan, do you wanna start here?
Sure. And I know it's Brandon unmuted too, so I can tag team and be organic in our responses here. Jenna, just was the question around just the distinction between these terms? And
well, I think often when we think about diversity, equity, and inclusion, at least in my own experience at Blue Cross, oftentimes that's kind of seen as something separate from employee wellness, or, we often kind of silo issues out as opposed to thinking about them holistically. And so, and I know that Christine, one of the things that she explicitly addressed in her opening remarks was around trauma-informed practices. And I know that is not something that is typically talked about in the employee wellness, workplace wellness space. And so just the interconnections.
Got it. So here's my kind of instinctual response to that. And I'm holding the polling results in the back of my head too. I think a lot of this conversation may be reinforcement for folks, but really quickly, I think diversity really gets at changing the composition of your associates, of who's at the table, right? And I think inclusion is trying to make sure that we're shifting hearts and minds, that the culture and the climate is really supportive of that difference. And then equity is really getting at changing power dynamics, how things are decided upon, how the architecture and design of an organization, right? So it's possible to have great diversity, but you have no equity, right? Like maybe at Blue Cross, I'll put Blue Cross on the spot. Like we have great cultural diversity in IT and claims, but let's examine our leadership team. Let's examine our board. Let's examine our management, right? So I think that it's important to see these elements in combination. So we need to change hearts, minds, and structures. And I think that's where equity comes in. And then you talked about trauma too, and I'll defer to Brandon to really go deep on this, but for me, I think it's just important to understand that the health and well-being of the workplace begins and ends way before and after the workplace. We are whole human beings, and our health and well-being is often influenced deeply before we even step into the physical or virtual space of our workplace, right? And so when, for example, when I hear about COVID-19, racism, and physical and verbal assaults on Hmong people and Asian Americans, the impact isn't just on a fear of getting a virus, it's actually personal safety, right? It covers the whole span of health and safety, from do I need to bring a pocket knife or pepper spray? And my wife, when we go on walks, because we have 2 young children, we actually we have a anti-racism plan everywhere we go, whether we're going to a grocery store or going on a walk in the park. And that plan includes personal physical safety as well as rhetoric and just like verbal defense. And so I just want to call that out, because I think from pandemic to epidemic, we're in a place where we need to see equity, diversity, inclusion, and trauma-informed practice as braided approaches. So I'll leave it at that for now.
That's great, Vaishan. And just to follow up, I would agree with that. And I love your definition and your explanation of diversity and inclusion. To add the trauma piece in there, it's almost like going to battle for a lot of BIPOC people of color all the time. And it's not just the physical safety piece. But I totally get that piece as well. Mm-hmm. it's also that psychological and that cognitive and emotional safety as well, that a lot of people, a lot of staff, managers, even people that are on boards of color have to consider when they're going into spaces. And that psychological battle ends up, there's actually a term for it called racial battle fatigue, where you are continuously always trying to protect yourself in these environments because people are making judgments, or they may have preconceived notions or stereotypes that you may not fit at all, but you know that just because of who you represent from a racial or ethnic standpoint, that may come up for you, and people may not, hear what you have to say. They may not validate your opinions or your experiences, and that can become very hard in the workplace. So it's the trauma-informed piece is understanding that some workplace environments, even though it's not intentional, are toxic stress environments, and people are coming into these spaces and they're gaining levels of anxiety that could be clinical, and it could turn into an actual mental health crisis for some staff people. But unfortunately, many organizations aren't aware of that because a lot of people of color who work in these organizations don't feel safe. They don't feel like the environment's going to listen to them if they have those concerns, or they just feel like that, they don't, if they do raise those concerns, there may be some sort of backlash. And that's a reality. So when we talk about having trauma-informed practices and we braid them, like Vaishan said, with equity, diversity, and inclusion, we have to be able to hear some difficult things about our organizations, about our policies and practices, and be willing to shift those things if they are causing harm to anyone. But you have to make space for those things to happen.
Definitely. Yeah. So what I was thinking about with regards to that was I had somebody come in and did a presentation at the department and made just a very simple and profound questions to the audience. And he said, when we talk about diversity, we're talking about diversity to what? And we're talking about equity to what? And then when we talk about inclusion to what? And one of the things that we never talk about is whiteness, right? Like we don't talk about that, which is what the whole conversation of equity, diversity, and inclusion is around the standard that is set and enforced and sustained by this made up concept of what is whiteness, which was a social construct that was developed, I think, 500 or 600 years ago. Whole nother conversation, but I think it's very it's important to note that that's a big piece that we just never talk about. Another part, and I know Brandon talks about this and is probably going to speak on this, but I was having a conversation just in preparation for this, and just in regards to the work that I do, is there's a whole level of conversation or feelings and emotions that Black and brown people feel and experience that we have been taught to keep hidden from white people. When we enter workspaces and institutions, there are so that's why when you go into organizations that are predominantly white and you go to the cafeteria at lunchtime, you're going to see the Black and brown people grouped together, because that's the one space that we can go to just be ourselves and just talk, and we don't have to worry about making anybody feel uncomfortable, right? So that's just something that, I don't think a lot of white folks understand that burden, right? And the level of exhaustion that we as professionals have when we enter into workspaces. There's a whole nother layer, and something Vaishan said that it just hit me in my heart. He said, I come from a storytelling community. That's my background. Like that, to me, that is so beautiful. Like, I love that, right? But we have to explain that. We have to, that's a disclaimer for us. We have to say when we come into conversations like this, oh, excuse me, because my culture, my community, does something different from the norm. This might be uncomfortable for you. So I'm going to give this disclaimer, right? Like, we have to do that. And I'm so glad he did. Anyway, he just stepped into that space. But some of us don't have the language. And some of us are, we hold it in, and it becomes toxic for us. I had a Native elder tell me once in a group I was in, and she said, we keep hearing this term, we have to walk in two worlds. You know, we have to walk in two worlds. We come into the workplace, we come into these institutions and we smile and we say, oh, I'm fine. I'm, you know, me and the kids are going here. And, you know, so we have this persona that we have to put on in the workspace. And then we come out of the workspace and then we have our own cultural ways of being and our own ways of communicating with our families and our community. And she said, but that's schizophrenia. She said, we shouldn't have to do that. Now, while we can't come into the workplace and practice, you know, certain ceremonies or traditions that we might have, right? And obviously there's some things that we all have to adapt to. There has to be a place and a way that those of us that come from communities that are impacted by all these health disparities from carrying these burdens can still come into workplaces and just be different. My way of knowing is different. My way of communicating is different. My way of interacting might be different, but that doesn't mean it's any less than, right? That doesn't mean I'm any less intelligent or any less important or valuable. But unfortunately, a lot of the norms we have, even in very progressive organizations and organizations that talk about equity and racism all the time, still have those cultural norms embedded within them and how they operate that still causes us to feel like who we are is not good enough. And so then we still have to give those disclaimers, you know, and about who we are. So I just wanted to note that as well. When we're thinking about well-being, there's a whole nother layer of this conversation that we don't have. And so I hope that, you know, I sparked something or planted some seeds into folks to just be thinking about some of those things.
Thank you so much to all three of you for sharing. So we did have a question come in that I'm going to ask in just a second, but you know, everything that the three of you said, it made me think of something that a consultant, an HR consultant, told me once, and it was kind of in the context of Blue Cross. And she said, most organizations hire for diversity and then onboard for assimilation. And it is making me think about what you're saying, Christine, about this kind of culture of whiteness, or sometimes we call it professionalism, right? And so the question that was asked that is related to this, to what we're talking about right now, is what HR specific changes or processes are needed? And I would probably make that a little bit more broad. So what kind of more broad policy and systems changes are needed in workplaces to make sure that we have, you know, equitable practices and that we start to change culture inside of our workplaces that we go to every day. And so, you know, I guess I'll ask maybe Brandon to go first this time. And then Vaishan or Christine, if you want to jump in, feel free.
Yeah, so, you know, I'm a big proponent of shifting workplace culture. You know, one thing that we have to keep in mind about institutions and entities is that they are made up of people, and culture is made up of people interactions. And when you have workplace culture that is causing harm to people, even if it's unintentional, and those people share that, whether it's in an exit interview or just in a complaint or a grievance, those things should be taken into consideration. And then leadership in those spaces should come together to figure out, how do we work on this? How do we move this forward? A lot of times I hear from a lot of HR professionals, because I touch base with a lot of them, that these are isolated incidents. And that's not necessarily always true. That might just be the one person who was able to voice the concerns of many. And so when it comes to the things that organizations receive, they should really take that information into account and apply it. But also make sure you're crafting a culture of equity inside your organization. And that means that sometimes things may have to be just done differently. And you may see a productivity level increase, and you know, your numbers may be better by just shifting. You know, I think we're at a place in time just in society where the ways that we used to do things need to be shifted and modified to where we currently are. And that includes equity, diversity, inclusion. So I'll pause there and I'll let the next two speak on it.
Yeah, I love the question, Jenna. Before following up with that question, I just, again, recognizing the polling results, and I just want to kind of reinforce that the case for advancing racial health equity is airtight from a public health standpoint and from a business standpoint. And I'm more than happy to follow up and send you all the data, the mountains of evidence and science behind this. But if there are questions around like the relevance of this to my business or my organization, what's the business impact, I'm happy to follow up with that. We did a study that quantified the economic costs of health inequities in Minnesota, and we found out that it's $2.26 billion per year just for Minnesota. And that's in lost wages, lost employment. And that's not to minimize the lost lives, which is 766 lives per year. And so we need to expand the moral imperative, never abandon it, but expand it to make sure that businesses, all organizations see their contribution to the root cause and their contribution to the long-term solutions, okay? So the question to me, I just wanna like balance the need to create empathy, emotional intelligence, and kind of that, that understanding of what Christine and Brandon has talked about, what BIPOC associates go through on a daily basis. But I'm also at a place where I can't wait any longer. Our people can't wait any longer, right? We've been waiting for over 400 years. So we can't rely on racial equity enlightenment or some kind of raised consciousness. We certainly should continue to nurture that through training, through supports. But I'm of the school of thought that we need to change policies and systems. And that's what public health tells us about changing behavior, right? Whether it's a smoke-free ordinance or raising the price of cigarettes, right? This is the blueprint of public health. And so I think for an organization, we need to start changing human resource policies, our contracting procurement, and our policy analysis, right? Kind of the big pillars of an organization: human, financial, and political capital. Like, where do we set our priorities? And then we approach that through policy change. I'm happy to send you all a equity policy that DHS, the largest state agency, ratified and developed. And if the biggest, clunkiest state agency, over 40% of our state, can do this, you can do this, right? Any organization can do this. Blue Cross can do this, and we've modeled it off of the DHS one. So I just want to emphasize that we can't just have good wishes and a welcoming mat on our door. We need to actually change procedure and make sure that there's a policy accountability mechanism that will actually impact how we hire, how we retain talent, and how we advance that. I'll give you an example. So this week, I had a chance to meet with DHS's anti-racism leadership team, and their HR team is going to embed a question for all new hires. So this is pre-hire. Our organization is committed to anti-racism. How will you contribute to that priority in your role and in that department? This is going to be a standard screening question for all new hires, right? So that to me is a systemic approach, and we're saying this isn't just a nice to have. It's not just an amenity. We are going to actively recruit future talent based on anti-racism commitments and capabilities. I kind of went along there, but I just want to hear. Yeah.
Oh, awesome. I love that. Yeah, no, that I think, like, coupled with, like, I was just going to say something that I think complements what Vaishan was saying. I'm a big metrics person. Like, I feel like, you know, anytime you're trying to reach a goal, you have to be really clear about what the goal is and how you know that you're on your way to getting to that goal, right? And being really clear about that. And I have not seen a lot of that in equity work, where it's just like, oh yeah, we're advancing equity. And I'm like, okay, well, what are your goals? How are you getting there? How do you know if you're successful? And let's break it down, right? Because again, we're talking about equity because of disparities. We're not going to be able to reverse the disparities that, as Vaishan said, it took us 400 years to get here. We're not gonna change these disparities in 5 years. We're not going to change them maybe in 20 years, right? But we need to have incremental changes. We can't just throw our hands up and say, oh, it's too overwhelming, it's too big. So along with those policy systems and environmental changes, which are crucial, how do we identify some metrics? How can we look at the engagement and the well-being of our BIPOC staff and really focus on that? Because that's going to be a different level of well-being than just your general well-being questions that are often being asked in these employee engagement efforts. What I was thinking about was, so the trauma-informed principles, I keep mentioning it, we keep talking about, come out of SAMHSA, which is, I don't know if everyone knows this, but it's the Substance Abuse and Mental Health Administration at the federal level. And if you just Google SAMHSA, it's HSA's trauma-informed principles, you'll see it all over the place. And there's 6 of them. A lot of times folks only talk about the first 5, which is trustworthiness, peer support, collaboration, empowerment, and safety. There's also a 6, which is cultural and gender and historical context. And it breaks those trauma-informed principles down. And of course, it's obviously for practitioners, but we're starting to see more and more organizations and systems realize that they need to become trauma-responsive systems, just like what Vaishan was saying. This is trauma and racism. These are public health issues. So we have to take a public health approach. And so even designing some employee engagement metrics, like, do my BIPOC staff feel a sense of safety? Do they feel a sense of collaboration, a mutual collaboration? Do they feel that their cultural ways of being are respected and acknowledged in the workplace, right? So like just thinking about what are some of the metrics that you could design to change to really look at, do our BIPOC staff feel a sense of belonging in this organization, right? Do they want to be here? Because I think recruitment is awesome. It's often talked about, but I can tell you, I know a lot of organizations that spend tons of money on recruitment and their number stays the same. And it's because they're having just the same amount of exodus as they are having with folks coming in. And so I feel like it's really, a dual approach. Recruitment is awesome, but if you really focus on retention for the folks that you already have in your organization, a lot of us come from collective communities, right? So we're going to tell our cousin, our brother, our friend, different people, we're speaking to our networks and we're like, yeah, this is a great place to work, and it's going to kind of take care of itself. So I try to encourage organizations that are really interested in focusing on recruitment to take a step back and also put as much energy in retention. So that would be my input to that.
Thank you so much, Christine. As a fellow public health person, I really, really love, setting goals and having outcomes and data. And I do want to let people know, the city of Bloomington actually just passed their racial equity business plan on Monday night. And if you want to see an example of kind of strategies, tactics, goals, and outcomes, like specific measures the city is going to be looking at and actively measuring, that's a great example of what I feel like I'm hearing Christine say. So I know we're already running out of time. I feel like we could talk. I wish we had a couple hours because I think there are lots of questions. But one I wanted to raise that is kind of related, as Brent mentioned, when we kicked this meeting off, Minneapolis has declared racism a public health crisis. Bloomington is considering it. The House of Representatives passed their own declaration. I know other cities across the state are also looking at passing resolutions or something similar. And so the question that I have is, how does declaring racism a public health crisis or a public health emergency impact the workplace moving forward? And what would you say this really means for the business community? And I feel like this one maybe is a little bit, it's a pretty big question. And so I will just ask whoever wants to jump in first, please feel free.
Well, I could just jump in. Just because the thought I was thinking about isn't, super complex and profound. I just, as a BIPOC woman who has been in the professional world for 15 years, I've always felt a sense of othering, and that I was the other. Even more so being a BIPOC woman that is in equity roles, I'm even more so the other. but to hear organizations and a city to say, you know what, this is going to be our burden too, is like the first time that I get a sense of feeling of being a part of the community. Because it's like, now we're going to acknowledge this publicly. We're going to say this is no longer okay. We're going to use our power and our influence and our platform to address this issue alongside you. And so that to me it gives me a sense of hope, because even though there's still a lot of actual on the ground work that needs to be done, right? Because words are words, paper is paper. It still is, to me, is that's how things started, right? Is with words and with paper. And if we can start naming these things and being bold, for me as a professional woman who has felt this and still feels this at times, it does feel like, okay, now I'm being brought into my community, to a city, and I can be a part of.
Yeah, really, really quick, Jenna, I know we're running short on time, but I would just say that the recognition of racism as a public health crisis is significant in itself, right? And I'm not content at just recognition, right? I think we all realize that's just a baseline but necessary starting point. You cannot have meaningful, durable change if you don't have that recognition and confrontation of what you are up against, right? So I think that's really important. One kind of key element I want to lift up in the kind of wave of resolutions that are coming out around this, including Minneapolis and Hennepin County, Ramsey County, but our House resolution formulated a legislative committee on racial justice. So we now have a dedicated legislative committee that will review all bills, all policies from a racial justice and intersectional perspective. So that to me is a structural change. It's not just a declaration of understanding and empathy and knowledge, right? It's actually, we're changing the way we do public policy. And I think a similar template can be applied to an organization. We recognize that structural racism is a public health crisis from COVID, diabetes, cardiovascular disease. It preceded and it will unfortunately follow COVID-19. But how do we, with that recognition, how do we embed it into our ongoing practices and structure? And so I think that the key nugget here for me is structural problems require structural solutions. You cannot throw a programmatic or educational solution at a structural problem. And we've been mismatched for so long. And so I think we now are on the cusp of like, wow, we're diagnosing it more accurately and we're tailoring our responses more on par with the nature of the problem. And so I think for organizations, that means we need to look at our power structure, our board composition, our bylaws, or our organizational policies and procedures. And so I think that's the way to go. And I would just say that's the number one implication of recognizing racism as a public health crisis.
Absolutely. I think Vaishan and Christine were right on point. The only other thing that I would add as kind of parting words and encouragement would be that systems need to have systematic solutions and people make up systems. Culture is social power. And when we're having these conversations around diversity, equity, inclusion, it's going to be uncomfortable. And people have to be okay with being in that place of discomfort, because there's no growth in a comfort zone and there's no comfort in a growth zone. And we are in a space, in a place where our businesses have to move forward with our community in order for all of us to thrive, in order for all of us to grow and to continue to build quality professionals and have quality services. So, you know, the work is not going to be easy, but it's definitely necessary.
Well, thank you, Brandon and Vaishan and Christine. I feel like that was a really great way to kind of wrap this conversation up. And I'm going to turn it back over to Brent. But again, I want to thank the three of you so much for letting me be the moderator for this conversation. It was really such a pleasure and a humbling experience. And so thank you again. And thank you to everybody who attended and to the Chamber for this opportunity for us to have this conversation. And I will turn it back over to Brent.
Thanks a lot, Jenna. Yes, I will reiterate, great job by you moderating, and for the speakers, Christine, Vaishan, and Brandon. You know, one of the benefits that kind of redounds to the chamber in terms of our relationships is being able to get great talent to present and to be able to connect people in the community. And I know that when we're talking about such a kind of big systemic issues, sometimes it can seem overwhelming and daunting, but we really are all in this together, and we all have a role to play in making change. And hopefully one of the things that we can do and help with our partners is help provide places to start. Some of you, thank you all for being part of this. You know, you need to be messengers for delivering this and spreading the word in terms of how you can engage, how you can connect with others. And, you know, I will do the shameless self-promotion of our MSP Wellness programming again. If you have ideas for future topics, if you're interested in getting involved with the cohort, our phenomenal Minneapolis Public Health Department staff liaison and expert, Mariah Maternoski, is on this call. And she is a terrific resource, but we can help be that connector and convener. The chamber doesn't necessarily have all the answers, but we need to be a part of the solution and in this space and spread that word to businesses of all sizes, as this really is a matter to, you know, I think Vaishan made the economic point, and it obviously goes well beyond that. There's a moral point. There's a lot in terms of making, you know, this region and our community better. And we've long looked at statistics that talk about where we are, and we know we can improve that. And we have the talent and the ability, and like I said, we're all in it. So that's my little soapbox for today. Again, thank you all for attending. Thank you to our
General Mills kicked it off. It's pretty robust at this point, but it's called the Minnesota Business Coalition for Racial Equity. I don't know a ton about it, but I would be happy to connect businesses who are interested in getting more information. I know they've got a policy committee, but they also have a committee that's focused much more on like internal HR policy, and then philanthropy and another one. So
yeah.
Happy to connect people if there's interest.
Thank you, Jenna. Yeah, that's great. With the follow-up email with some resources and the connection to this meeting recording, please respond as you'd like in terms of ideas or opportunities to expand this, because as we said, this is a conversation that should not be limited to just an hour. So we know there will be legs to it, and we want your input. So